I grew up in Boston. I was the youngest of 3 children. From a young age, I think I always wanted to be a physician, but you know, as a kid, you probably dream of being like a professional athlete, so I probably had some of those dreams as a kid as well. I'm a sports fan. Growing up in Boston, I was a big Boston Celtics and Patriot and Red Sox fan, so I enjoy watching games and then also playing. I have 5 children, so whenever I have free time, try to get out and play basketball or throw a ball with the kids. I lived for a short time when I was in California in the Hollywood area. I was mistaken a few times for some Hollywood actor. The funniest one was I was once accused of being Sylvester Stallone. When I was waiting at a bus stop, a lady thought I was Sylvester Stallone and told her if I was Sylvester Stallone, I probably wouldn't be at the bus stop. So, I always had a desire to help people. And from a young age, I had some health problems when I was a kid and spent a lot of time at the Boston Children's Hospital and kind of in the orthopedic area, and was just fascinated by medicine and health, and I think that was kind of an inspiring thing for me as a child. One of the first interviews I had was here in Tyler, and one of the things that impressed me most was most of the physicians I met were men of faith, and they could outwardly express their faith in their practice, and that seemed to be something that was not practiced in many parts of the country. I determined early on that I probably wasn't cut out to be a surgeon since I couldn't draw a straight line, but I did enjoy working with musculoskeletal problems and joint problems, and then also neurologic issues. So PM&R, which is our abbreviation, kind of combines those 2 specialties, so it's worked out great for me. First and foremost, I try to be very punctual, and because I know people don't like to be waiting, so I'm on time. I try to be very thorough. I know most people that come to me have already seen their primary doctors and coming to seek answers. Why does my back hurt? And so I try to go the extra mile and be able to give them a definitive diagnosis that they can take home.